Nutrition and health, people. What's being mentioned here? Nutrition your heart. Nourish your heart, should they say. Small dietary changes can lead to what? Large reduction in the burden of the cardiovascular system. So, please, I would like to give an emphasis on this. Low fruit and vegetable intake is estimated to cause 31% of coronary heart disease and 11% of stroke clients. Let me repeat this again, and let me ask you this question again. Who amongst you can eat 5 fruits and vegetables every day? Can you please raise your hands? Medium-sized or big? So, wala na. So, you belong to this bracket. Yeah. So, people, it shows specific nutrients play a key role in maintaining a healthy heart. So, people, let's talk about this. There are 5 ways. How many? 5 ways to improve the workings of a healthy heart. First, promote healthy heart function. Exercise. Second, promote healthy blood lipids. Diet. Try to avoid fried pork, fried beef, people. Third, prevent LDL cholesterol oxidation. Then, of course, promote healthy blood pressure. By all means, please try to lower down your weight. And finally, guys, support healthy circulation and, of course, blood vessels. Sleeping is part of which, guys. I know some of you would like to earn. Yes or no?
Yes.
And sometimes you try to compromise your sleeping hours. Please, you're adding stress physically and emotionally and mentally to your body. And that can lead to what? Heart problems or cardiovascular diseases. And that's not the proper way to do it, people. Next. What's the name of our product, guys? Villena Pharmaceutical Drink. Okay. If again you would like to invite doctors, convince doctors to become part of our company, this is the product that I would like you to know by heart. Why? Because it is the world's first cardioceutical drink with human clinical studies. I would like to remind you people that as a doctor, as a physician, we were trained to ask people promoting herbal products if you have clinical studies. Because if you cannot present to us clinical studies of your product, then it only means one thing: that product is said to be a low-class product. Okay? So guys, what's good in our company is that we have numerous clinical studies. Okay. The components will be nitrobera, nutriment, and it also contains stevia. The reason why when you drink Vita, that product, it's sweet. But I would like to remind you people, sugar-free. Are we clear so far? Okay, next. The flavor is of course natural grape and it is FDA approved. So let's continue, people. And these are the 2 components. Can you please read it out, people? Resvita and Redivivo. Other word, say it louder. Trans-resveratrol. Can you please say it loud? And lycopene. Louder, people. Lycopene. And of course, the ones that produce Resvita and Redivivo is DSM. A so-called billion-euro company. Next. Resvita. Let's talk about Resvita first. Promotes healthy aging, yes, with high purity resveratrol, trans-resveratrol. Guys, resveratrol are said to be found, okay, in the red wine. And they're considered to be a very powerful antioxidants. Now, I've already mentioned this one, but I'm going to repeat this. Okay? Death rate from coronary heart disease in France is said to be low despite high intake of saturated fats. Why again? Because of their fond of drinking what? Red wine. As I mentioned earlier, people, red wine contains what? Resveratrol. Next, people, if we're going to give an overview scientifically of the functions of resveratrol, these are the so-called beneficial effects of taking resveratrol. For those people whose age is 35 years old inside this room, look at this. And try to listen, guys. Why? You will benefit from this. First, you can try to mimic calorie restriction. So instead of you eating this much, you will only eat that much. It can extend your lifespan by approximately 36%. Okay? Third, Can you please welcome in the house my friend, Dr. Philip Chia. It will also give you resistance to LDL oxidation. What else? Reduction of myocardial infarction or infarct size that can lead to heart attack. Then, improve endurance. They will try to improve your metabolism. What else? Prevents degeneration of the nerves or even the cells of the brain. And finally, people, Resvita is bioavailable in humans. If you will take this, guys, it will have a beneficial effects in your body. Finally, it is the first DSM-funded human study on resveratrol. So, with these functions of resveratrol, do we have a wonderful product in Vida? Yes or no?
Yes!
And this is the wonderful product. When you talk about vascular function, the inner wall is said to be made up of, or we call them as endothelium. And if you want the blood flow to flow freely, people, in your body, then you must be able to preserve the function of your endothelium and try to prevent atherosclerosis, or the so-called hardening and thickening of the blood vessels from happening inside your blood vessels. Now, how can we be able to assess that? Through flow-mediated dilation. We'll go on that further, people. Now, this flow-mediated dilation is measured, of course, by ultrasound. They try to measure through ultrasound, and it can be affected or reduced by these factors. Increase lipid or fats in your blood. Second, if you're so fat, if your blood pressure is so high, if you happen to have a high sugar level, and finally, if you're suffering from different kinds of coronary artery diseases. Next, okay? Studies were done that try to prove, okay, the effectiveness of Resvita. Guys, they were able to give that client different dosage of Resvita, should I say, and they were able also to give placebo, 0 milligrams. Okay? It's a substance that has no function at all. And try to compare it with 30 milligrams of Resvita, 90 milligrams, and 270 milligrams. Try to look at these guys. After giving it once a day, okay, on the first hour itself, guys, it was able to know that as you increase the milligram dosage of Resvita, there was also an increase in resveratrol in your plasma concentration with each dose of Resvita. So people, approximately, it was able to show a dilation of your arteries by 62% up to 91% if you will drink Vida on the very first hour. Guys, if that is the case, the question is, do we have a wonderful product in Vida? Yes or no?
Yes!
Because once you dilate the blood vessels, people, you will also try to improve the flow of blood. And once you improve the flow of blood, guys, the flow of nutrients, vitamins, minerals, oxygen that will give you energy will also improve your body. The question is, will that make you healthier? Yes or no?
Yes!
Now, that is during the first hour. So, what will happen? Of course, the blood pressure will also normalize if you will take it every day. So what they did, okay, was to give Vida for approximately 6 weeks to 8 weeks. Okay? And people, again, studies have shown that if you will just take 75 milligrams of Resvita every day, and I would like to remind you people that once a share of Vida that should be mixed and dissolved in 500 ml of water already contains 90 milligrams. Guys, the requirement was only 75. The ones present in your product is 90 milligrams. So the big question is, have you gone beyond the requirements, yes or no?
Yes!
Guys, take it every day. Drink it, please. The word is please drink it every day. In a span of 6 to 8 weeks, it will further dilate your blood vessels by approximately 23%. So with that, people, are we getting better as the day passes by with Vida Ring Global, yes or no?
Yes.
Can you please give a hand for our product? And I love this word. I would like you to say it loud, guys. Metabolism. Can you please say it loud, people? Metabolism. Ability of the body to convert nutrients. Again, from macro to micro. Why? To form energy. Or from micro to macro to repair the body. Guys, I would like to clarify that if your objective is just a day later open up the blood vessels, then you only need to drink 1 sachet of Vida every day. But if your objective is to speed up your metabolism, you need to drink 2 sachets of Vida every day. People, look at what happened. And look at the outcome of this whole study. Okay? So they just gave 275 milligrams of breast Vida compared to placebo. And what happened to people? Is that, number 1, it was able to normalize your blood pressure. Why again? By dilating the blood vessels. Second, it was also able to improve your blood sugar. And, of course, it was able to sensitize your insulin. Next, reduce inflammation that will try to improve the flow of blood. And finally, they can also help burn fats and convert this into energy for you to be able to lose weight. So with these people, maganda ba ang term ng Vida so far? Yes or no?
Yes.
Another hand for the spot. Next component, people. Can you please say it loud? Lycopene. Okay. That is Rade Vivo. Guys, lycopene is inversely, kabaligtaran, associated with markers of atherosclerosis. Mean to say, we can be able to prevent the hardening and thickening of the blood vessel wall. And what else, guys? It is also very strong. This time, can you please read it loud? Antioxidants. It has an anti-cancer components. So just try to analyze people with all of these. Do we have a magnificent product in Vida Ring Global? Yes or no?
Yes.
Kami pala pa malakas. What do we call it? Activist Vida Ecology. Okay? If I'm going to drink Vida, people, the products will be what protected. Okay? Inside your stomach. But once it reaches the cell, then the so-called components of Vida will be released. Why? In order for your cells, okay, to be able to absorb the components of Vida. So with that, guys, maganda ba ang function so far ng Vida? Yes or no?
Yes.
Next one. Let's talk about flow dilation. How can we be able to be sure, though, if our blood vessels are really dilating or opening up? FMD. It is now the biomarker for human cardiovascular health. Look at this, people, and listen to this one. Okay? Introducing the most advanced, non-invasive angiogram alternative. It is not a replacement, it's only an alternative. Okay? Categorized as Class 2 medical equipment by USFDA. So, people, what is the name of our product? Cardiopulse. It's a device, people. It's a device. Okay? Before we discuss it further, the 10 leading cause of morbidity, of course, when you talk about morbidity diseases, that is the heart. But when you talk about death, number 1 and number 2 will be your cardiovascular. Let's talk about facts here in the Philippines. 3 in every 10 Filipinos will suffer from heart disease. Approximately, we're more than 100. But let's just try to imagine that we are 100 inside this room. So 3 out of 10, which means 30 out of 100, will suffer from heart disease later on. And look at this, 70% of heart disease patients, that is the 70% of the 30, will not survive. So if I'm going to look at your faces, approximately 20 of you will not survive. So again, can you please look at the one beside you? Ikaw yun. So people, would you like to be healthy, yes or no?
Yes.
So guys, now, ito po, what's the response again? Hardening and thickening of the blood vessel wall. Okay? Plaque buildups inside your arterial wall. But the problem is, once it ruptures, guys, it will further what? Block the blood flow. And again, that will lead to heart attack or even stroke. Let's continue, guys. This is what I fear most. For you to suffer from cardiopulmonary arrest. And again, I would like to remind you, it is said to be asymptomatic. That once you start feeling that all chest pain, it may be too late because in a matter of few minutes, you may die. People, there are said to be non-invasive procedures that you can do: X-ray, 2D echo, ECG, CT scan, and of course MRI. I guess it's approximately around 10,000 pesos. Okay? Or more. At least it's 10,000. Okay? What else? Invasive. This one is not expensive. The cheapest will be 50,000. As high as 100 to 150,000. What will they do, people? Of course, they will try to insert a catheter in one of your major blood vessels, and it will end up in your coronary artery. To be able to look if the coronary arteries are still functioning well. Okay? Now, what should they do? What should we do? First, know your potential risk of heart attack or stroke. Does it run in your family? Do you have histories of relatives or friends who suffer from stroke or heart attack? Or should I say relatives who suffer from stroke or heart attack? Second, know the amount of plaque buildup or blemish in our place. How can you find it out, people? ECG, 2D echo. Know the condition of your blood circulation. Know the level of your physical and mental stress. And these are the things that you would like to find out if you're really healthy or not. Now, again, category class 2, equivalent A and made in South Korea. Guys, again, what's the name of this product? CardioPulse. Fast, safe, convenient, accurate diagnosis, non-invasive, people is worth affordable. Who among you have undergone CardioPulse test? Can you see raise your hands po? Let's give them a round of applause. Okay. And for undergoing CardioPulse. So there's still many of you who haven't tried this procedure before. I would like to clarify, guys, it's an angiogram alternative. If you don't have the money yet to undergo angiogram, please do this initial step. Or, it's a good step for you to find out if your blood vessels are functioning that well. Okay? Guys, it is through electrical wavelengths. Can you please say the words? Electrical wavelengths. Now, people, what's the procedure? How does it go? You will please avoid, or should I say NPO, don't eat for 3 hours before the actual procedure. Don't drink stimulants like coffee, tea, chocolates 3 hours prior to the test. Once you go inside that clinic, our CardioPulse clinic, okay, that can be seen in all the branches and centers of the global, nationwide and worldwide, okay? We have to ask you to rest for approximately 30 minutes to 1 hour. Then, remove all the gadgets, okay, rings, watch, necklace, okay, everything, even coins. And if I may ask the guys to remove your belts, okay? Only your belts. That I would like to clarify, okay? So, after which you will sit comfortable in a chair, okay? Use the back chair, guys. Then place your left hand on an armchair or table at the level of the heart. And after which, place the CardioPulse as big as a stapler on your left index finger. Be sure that you'll be able to feel that so-called small opening under. No manicure, nail polish should be removed. Okay? Now, the test will only run for approximately 3 minutes. And what should be the steps that you should undergo during the actual test? These are the so-called requirements. First, you're not supposed to talk. You're not supposed to cough. Prevent from smiling or even laughing. And please, do not close your eyes for more than 10 seconds. Especially now. Now, after 3 minutes, people, after just 3 minutes, we will give you the actual result, okay? And that will be the things that you will be able to see on that so-called paper. So, sympathetic and parasympathetic nervous system, you should be at the center for it to be functioning well. Second will be your physical and mental stress. Again, are all of us suffering from stress, yes or no? Yes. Heart rate approximately from 60 to 80, maximum 100. Also note for ectopic beats or irregular beats of the heart. And guys,